Hello, everyone. My name is Dorothy Guerrero, and welcome to this series of interviews, Southern Perspectives on the Coronavirus Pandemic. In this collection of interviews, we are focusing on news and analysis from leaders and representatives of social movements and progressive non-government organizations from Southern countries that are collectively addressing the pandemic. And more importantly, we are also sharing how they are imagining and shaping the world anew after the pandemic. We are very lucky that today we have Thi Thanh Ha, Deputy Director of Center of Supporting Community Development Initiatives. It's an NGO that is working in Hanoi and other places, I imagine. So, hello, Ha, how are you? How are you today?
Hello, Dorothy. Hello, I'm good. How are you?
Okay, I'm fine as well. So thank you for giving us your morning and or afternoon already in your time. I'm forgetting that. Sorry about that. So maybe you can tell us more before the start of the interview. What is your organization? What do you do, and what communities you are focusing on?
Yes, SCDI is a non-government and local NGO in Vietnam. We are based in Hanoi, and we work and support for vulnerable groups in society. They are drug user, sex worker, LGBT community, and transgender. And we also support for the vulnerable children. They are the children of the sex worker and HIV AIDS patient and drug user. So you can say we work from very bottom line. Yeah,
Yeah, I mean that must
and
be.
SCDI established. SCDI established in 2010, and this year we celebrate 11 years old.
Oh, congratulations. I can
Thank you.
imagine that it's a very, very challenging work. As you mentioned, you work with those that are in the bottom of society and also very marginalized and not serviced enough by government or other agencies that are working on and servicing different sectors. So in the time when the pandemic hit, what do you see as the as how did you shift your work? Because most organization, whatever they do, whether they are organizing trade unions or women's group or building cooperatives, most organizations shifted when the pandemic started and adjusted their work to serve also the needs of their constituents and their partners during the time of the pandemic. So, and it's more than a year now since it hit Vietnam. So, how did you change your organizational focus? Did you change at all? How did you adapt it to that situation?
Um, Everyone knows us because the vision of SCDI is to improve the quality of life of vulnerable group. So when the COVID-19 happened in March of 2020, the first time the government applied the lockdown at the end of the month. So we immediately support our group by provide them the food. The food is the food because they have a simple job. So when the everything's closed and restaurant closed, the shop is closed. So they like almost of them lost their job. So even they don't have a food for every day. So we immediately support the food. We have a food bucket for support the family and the children. And then we provide them also the masks, the hand liquid. Yes. So we because the first time when the lockdown applied, everyone seemed to be panic So they try to stay home, but with the people with the simple job, they immediately lost. So we try to immediately support them,
Yeah. Oh,
to
well,
make them feel that
and
they not to be behind.
yeah, I'm sure that that work that you do uh, was very much appreciated, and still a lot of people are benefiting from that work. From here in the UK, people are not very familiar with what's happening in Vietnam. Although every now and then we see the news that Vietnam, compared to many countries in the developing world, managed to manage the pandemic quite well. It did not go towards the red lines that many epidemiologists are scared to are worried about. So, what do you see as the most important aspect about Vietnam in the context of the COVID-19 pandemic over the last year? How did it manage to be more successful than other countries?
So I think in Vietnam, when the COVID-19 happened, the most important aspect is our government doing good. And I confident to state that our people have a solidarity and agree with the program that the government apply. Their own people respect the order, the rule, and we um, we help each other. The first time when I see that, we also afraid that people on the streets, they cannot buy the food, they cannot go to the supermarket. But the government, I think they're doing good in Vietnam when the COVID-19 happened.
Yeah. What are these support? Can you also share that with us? What kind of support did the government extend? And also, did that also cover the people that you work with? What you mentioned, the LGBTQ people, the those that are drug users, homeless, or children of drug users. Did the help or support also reach them?
Um, do you know when the COVID-19 happened, I think the community have each other as themselves. Like we have a lot of can I say the charity group. They immediately provide food for the people living on the streets. And the program, it happens sometime, but but I very impressive in the COVID-19 periods. There is a lot of charity group. They immediately respond to help each other. So like us, we know the drug abuser group. We support the sex worker and LGBT, and especially for the people living on the street.
And what can you say now about the fact that in different countries they started, including Vietnam, rolling out the vaccination program? And can you also tell us about that? How is the this program of inoculating people to protect them from COVID-19? How is it being implemented in Vietnam?
Yes, I think the people know other than COVAX, the program of WHO and the other unions to provide for the different country. So at the end of the month, Vietnam received nearly million doses of COVAX COVID-19 vaccine for Vietnam, and I know that our government have have a program and discuss and deal with the other country to buy the COVID-19 vaccine for everyone. And the government have a resolution number 2021 date in 26 February of 2021. They said that there are 9 priority groups should be have a vaccine soon. So I think in March and April, the government start to provide the vaccine for 9 priority group already. It includes the soldiers, the doctors, the nurse, and also the people over 25, the elderly people over 25. Yeah. So in Vietnam, we had.
Yeah, I just wanted to clarify that. So in Vietnam, you are having a different approach then. So you are prioritizing the younger people who are out and about and working to prevent the widespread, the spread of the virus. Is that correct?
No, not really. I say again, there are 9 priority groups and free COVID-19 vaccine. And in 2021, the government estimate we need about the 150 million doses. And then after the 9 priority group, they have a vaccine, and then like us, the worker and for the non-government office and the other people in society after the 9 priority group. Yeah.
Okay. So thank you about that. When at this point, do you know how many people were already vaccinated, and can you say that they are on target when it comes to, did they set up like a time?
Yes, I already prepared, but I can find somewhere because yeah.
A rough estimate. Can you say like 10%, 2%, 3% of the population already received the doses, or at least the first dose of the vaccine?
And nearly 40,000 doses already give to the people.
Okay.
Yeah.
No, that is good. A number of other developing countries have yet to receive, a single person have yet to receive a dose. And can you also tell us about the, I've also read in the news that there is a locally made vaccine being developed by the Vietnamese laboratory. So can you tell us about that? Because that's pretty exciting, that there will be a...
Yeah, very exciting, because now we have 4 clinic of Vietnamese Vietnam clinic to conduct the research, and they try to product the COVID-19 vaccine. And we expect that in this September we will have a 19 COVID made in Vietnam.
So you mean it's already being tried? It is already in the process of trial?
In process, and they have a first pilot. They have a first pilot, and now they still have to examine and continue to research and follow the result.
Yeah.
So we expect that in this September, the first time we have a made in Vietnam.
Yeah, and this formula is a Vietnamese formula. So
the formula we I know that the formula we conduct and research by ourselves. Mm.
Oh, that's very exciting indeed. And it's also good to share this kind of information, because one of the questions that are posed to us whenever we say that we should waive some of the intellectual property rights in the WTO, many people, for many people, the first question is, yeah, but are there other pharmaceuticals in the developing countries that could produce the vaccines and help in producing more vaccines for everyone? So it's good to show that a country like Vietnam is making its own vaccine, and then have the know-how, the facilities, and the capacity to produce your own vaccine. So that's very good indeed, and indeed very exciting. Can you tell us, you have a new prime minister, and from what we hear from here as well is that he was very, very efficient in managing the pandemic, formerly, before he was elected in his current position. So what can we expect now with your new prime minister? Can you tell us about that?
Because it's very, very new. We just have him for 2 days ago. But I mean, I'm felt lucky because the minister Vũ Đức Đam, who's in charge in the COVID-19 in the period is still there, and so I mean the deputy is still there and support the program. Honestly, I don't know the new program from the new prime minister, but I think the Mr. Vũ Đức Đam is still in charge of the program from government. So we still have very new pride for the COVID-19 in Vietnam, because nowadays for today we don't have any case in the community. We just have a COVID-19 from the foreigner people import in the airport. Yeah.
Oh, that's amazing. And yeah, of course, we do wish Mr. Vũ Đức Đam success in keeping it that way, and not having the Vietnamese population have the records that are what we are seeing in other countries. Maybe for the last part of this interview, can you tell us what do you see, or if there changes that your organization would like to see when it comes to what will be the future? We are seeing that with the vaccination program being rolled out, we could say that maybe the end of the light at the end of the tunnel is indeed here. But are there things that you wanted to work together with other groups in Vietnam, especially on the sector, the groups that you are supporting? Like if you have
yes,
a you want to happen.
Yes, COVID-19 happened and make change for everyone in the world. We can say that for SCDI, and we believe and I believe with the approach that the Vietnamese government apply now, the COVID-19 is under control, and we hope that at the end of 2021 we have a vaccine for everyone in Vietnam, and we hope that the COVID-19 is the end of 2021 in the world as well.
Yeah, actually, I have to ask as well, because I was reminded when you said that there are now 40,000, 400,000, 40,000 people that were already vaccinated.
40,000, yeah.
So where do the vaccine come from?
The vaccine now come from the it's named COVAX,
yeah,
and
yeah,
come from the WHO.
So, okay. So what kind of vaccines are they? Are they Pfizer or AstraZeneca or Moderna or Sinovac? What kind of vaccines are they? What?
I don't know the detail.
Okay.
Honestly, I should know come from the WHO.
Yeah. Okay, from the World Health Organization, from the COVAX.
Yeah.
Definitely. Okay, so thank you, Ha, and this has been very informative, and I hope that I wish you more success in your work in the communities that you work with, and also for Vietnam to keep its low record of infection and low number of death, and we wish that for every country. So thank you very much.
Thank you very much. Yeah, thank you very much. And I also with you in and everyone in UK and in the world. Stay healthy and strong. And I hope that the COVID-19 is gone soon, very soon, and we have a vaccine to hit it.
Okay.
Thank you very much.
Yeah, we're keeping our.
Yeah, I'm very happy to talk with you today and share with you some information from Hanoi, Vietnam.
Yeah, we appreciate that.
Thank you.
So thank you and take care. Bye bye.
Thank you. Thank you.